Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. Well, Dr. Prather, we're talking about a new paradigm in healthcare, a new primary care model. Mm-hmm. And what is this new model for primary care?
It is a contrast to the old model where we are dealing with structure function. Mm-hmm. The old model is what would be considered disease care model. The FDA has two different models that they actually put everything through. Structure function and disease care. And we have been a nation of disease care mm-hmm. with some problems. Right. That have actually developed because of that. We have a crisis in our healthcare system. It has become an unsustainable type of a monstrosity mm-hmm. that the federal government can't maintain, businesses can't maintain, and it has become a failure. So it's something that has to change. And one of the things is that the whole Affordable Health Care Act is designed to
Did you say hacked?
No,
Act.
The new Affordable Health Care Act. Uh-huh. But hacked could be a good thing. Is designed to try to change that model. And, we're seeing how that's going to turn out, see if that's actually making some changes. But if you have the basic type of healthcare that is flawed, and you keep doing the same thing, you're going to be getting the same results. Mm-hmm. So, there needs to be a new paradigm, and that's what we're talking about today.
Well, how does this new paradigm called structure function, the FDA calls it structure function.
Structure function, that is the official term.
Contrast to the old model, the disease care model?
Sure, and the old model is, when you're talking about disease, people think that diseases, because we're so into it, mm-hmm. is something that's actually real. Mm. Diseases is a made-up thing by people, that it's a set of symptoms that they have combined and have put a name to it.
Okay.
Okay?
Yeah, like people, they want a diagnosis.
Right, and in any type of an operating type of system right now within the disease care model, you need a diagnosis to be able to start the treatment. But the understanding what is the basis of things, and we have gotten so used to it mm-hmm. in this paradigm that if you go to other countries where they don't have this paradigm
the
disease model, they think we're crazy.
Mm-hmm. So are you saying disease is something we've made up, or?
Disease is actually something that we have used to classify a set of symptoms and then to be able to communicate between healthcare professionals mm-hmm. and payers. Uh-huh. So it is a term that has been created for classification, and it's something that is necessary within the disease model to operate under. And, people say, I have this or I have that. Mm-hmm. And, as we do the studies on it, you can have the same diagnosis and totally different types of causes. So when you're talking about a structure function type of model, you're looking at the underlying truth behind the disease model.
The root.
The root. Mm-hmm. What is it that is not functioning correctly that has created this? You can have totally different types of causes and come up with the same symptomatology that has been classified as a disease. Mm-hmm. And, it's just how that manifests out in the body. So, it
has to play with people's mind, too.
Yeah.
In fact, we had a patient who was misdiagnosed. They said he had MS. 10 years later, they find out he never had MS.
Sure.
He lived with the thought that he had MS.
Yeah. A very interesting story along those lines. I had a patient came in and, he had told me that he was diagnosed with HIV. He had heard that we had had some good results with that.
Yeah.
on treating patients, and I had looked at his, because it was early into the whole HIV thing that was going on, and I said, well, let me look at your, labs. And I said, okay, and the follow-up test, where's that? Because you can't make a diagnosis on just what was done on him. You understand what I'm saying? In other words, it was an improper diagnosis. And he said, well, I didn't have any. And I said, well, first thing we're going to do is we're going to follow the rules. This is how you diagnose it. So we're going to do that, just to see.
The follow-up.
The
he
follow-up.
Didn't have the follow-up.
And he says, well, I've got it. I've got all the, the lymphocyte changes, all the different types of things that go along with it. I said, I know, but we still follow the rules. And I understand that. And we got it back, and he didn't have HIV.
Wow.
And he had all the symptoms. He had even the T-cell changes. He had all the different types of things that go along with it. And he goes, what do you mean I don't have it? I said, you don't have it. He said, but what about all these signs and symptoms? I said, I can't explain those, but you don't have it. And we followed up on him, and within 2 weeks, all of his signs and symptoms were gone.
Oh, gosh.
His white blood cell went back to normal. All of the things that were manifesting on that were gone. He had read so much about it that his body manifested it. He became that.
You wonder how much that happens,
the mind is very powerful. And when we put a label on something, that creates a power within it.
Yes.
And you...
But some people want that label. I have fibromyalgia.
Right. Right. And there's no such thing as true fibromyalgia. There are a lot of things that can be involved in that, but that's not the reality. What is the underlying reality? And that's really where structure function is a totally different type of approach. We're wanting to understand the basic physiology, the basic structural changes, the things that go into the underlying problem, that if you take away, you can really get the true healing instead of just handling the symptomatology.
Right.
So diseases is symptoms. Structure function is cause.
Okay. Yeah, and I think, disease care model, the old model, treats the symptoms.
Treats the symptoms. It does not treat the cause. It's not supposed to. It's not designed to. That's not what its purpose is.
I notice, you've done a structure function medicine talk. You kind of, this is evolving. You're saying now this is the new model, where you put them side by side before. Is this, so this is the new paradigm? This is a new paradigm that is trying to be introduced into the care model. Now,
the powers that be used to call it alternative health care. They came up with complementary health care. They've had a lot of different types of names, but the truth of it is that structure function care has been around forever, just as long as the disease model. The disease model has been around for quite a while. It just hasn't been prevalent until until about 1915 is when it really started to become prevalent. Really took over in the 1930s. And then has been reached its dominance basically in the 50s, where there really almost wasn't any structure function care. People started to say, this model isn't necessarily working, so they became more and more
You're talking
interested.
About which model?
The disease care model was not working. And so when in the 1990s, they just decided to do a research. How many people are using different care besides the disease care model? And they found out that 50% of all the healthcare dollars were being spent on structure function type care.
Wow, 50%.
50%. And
that was a lot of out-of-pocket.
There was a lot of out-of-pocket. And there was no coverage really for in the insurance model for that.
Thank God for HSAs.
So, that was a wake-up call that something is, that this is going on. And the public have already determined that they want something else. And, the federal government looked at this and said, this is an unsustainable and a very poorly producing model. In other words, we're spending more than anybody else and we're getting terrible results. And we can't sustain the cost that's involved with this. So there needs to be some other different type of model that's going on. And it just makes sense if we sit there and take a look at it. But we have been inundated within our society that this is the normal and what is truth. And, that is not actually true. You go to other countries, you go other places, and, they think about the healthcare model that we actually practice in the United States. And though it has a lot of benefits in crisis type of care, in regular everyday care, it's really a complete failure.
Well, what are the benefits, to this new model, the structure-function model?
The benefits to this new model is that, one, we wind up with much better health. They have done a very large study up in Chicago, and I've talked about this before, with a HMO, Blue Cross Blue Shield, around the Chicago area with 60,000 people. And it was very impressive to the federal government because in a 5-year study, they found that there was a 40% savings with this model.
Wow.
In other words, they were able to cut down their costs by 40%. They did a study in the next 10 years, and there was actually over a 60% savings. So as you go along, the savings actually increased. Also, there was 85% less adverse reactions. In other words, there was 85% improvement in the overall health of those who were actually doing the structure-function model. The patients gave the structure-function model a 90% rating. They gave a 60% rating to the disease care model. Now, the interesting part is both of them use the disease care specialists. And when we're talking about what is this model that's actually going to work real well, we're looking at primary care as structure function, where we improve the health of the individual. We're talking about disease care for the crisis situations.
That's how they work together, which you've been, okay.
That's how they really work together, where really the primary care, where you take care of the patient, but when someone actually has a failure of their system and their homeostasis is no longer sustainable, disease care model is very good on getting things under control and get those reversed.
Okay. When we come back, let's talk more about the new paradigm in healthcare. You can win a free 60-minute massage in a relaxing spa at the Prather practice. Each month, we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather practice.
What I'm talking about today is the Atlas orthogonal technique, which is very dear to my heart. The Atlas orthogonal technique is really what saved my life. I had Graves' disease and was having a lot of difficulties with it. And I went and had an Atlas orthogonist adjust my neck, and within 3 months, all my health problems were actually gone. So that's at the time that I decided to dedicate myself to the pursuit of people's health, because I had such a relief along this. And the basis and the cornerstone of my practice is the Atlas orthogonal technique, which is a specific adjustment to the cervical spine, concentrating on the atlas as a lever mechanism. The area of the atlas, occiput, and axis is the most important area of your body. It is the lower brain stem, which controls all the autonomic nervous system, the whole nervous system that is beyond our mental control, and is considered by the body as the most important area. Any type of an injury to that area will cause instantaneous death. So looking at that and working with it can have a very, very huge impact on people's health and well-being. I actually was able to go with an intern with Dr. Sweat, who is the originator of the Atlas orthogonal technique. and was able to be involved in the complete development. I was in the original 6 who was trained in that. I am, at this point, the only board-certified Atlas orthogonist in the state of Indiana. It is a 3-year postgraduate work and can have a huge impact on people's health. Matter of fact, I consider that probably the most important thing that you can do to have the biggest impact on your health is to actually have your Atlas put back into proper position. That is something that someone needs to have done, to have checked, and make sure that that's good and should be checked at least once a year.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest. Well, we're talking today about a new paradigm in healthcare with the new primary care model. How would you describe primary care?
Primary care is the family physician, the gatekeeper. Yeah. In other words, you come in and they say, what's going on, kind of do some investigation, and try to keep you healthy. That's really what a primary care physician should be. Preventative type of care, getting the body back into homeostasis, and then referring on to a specialist, actually a disease care model, when the body is no longer able to maintain homeostasis. Okay.
So this new paradigm
in
healthcare is called structure function medicine, structure function care. What is it?
Structure function care is based off of the idea of homeostasis. And if you read Dr. Guyton's book on physiology, that was the one that I was cut my teeth on in school. I don't know if that's actually still being used because it is a little bit older and we have come a long ways, and he has passed away. In the beginning, in his intro, which I thought was very interesting, he says, the definition of health is homeostasis, and homeostasis is health. And that's where the body is able to maintain an equilibrium. And that's what we're looking for. So, the basis of structure function is to find out where the body is out of equilibrium and bring it back into proper balance.
Yeah, it's interesting when radio listeners come in as patients, they have that down. They know what that means, because everything we do here is we're assisting the body into homeostasis.
And it's hard for people to understand as they come in if they have been thinking of the disease care model. They think of health as a lack of symptoms. Okay? That is the definition of health to people out there. And then, I had no symptomatology, and then all of a sudden, they say I got 3 months to live. Well, you were never in homeostasis. You know what I mean?
Yeah.
And I actually do have people coming in along those lines.
They wait till they feel sick or...
So everything's just a crisis at that point.
A crisis, yeah. And they're just, it's like fires burning everywhere.
Right. So, as you're looking at a structure function model, we're very, very, you have to dig deep. So lab tests, diagnostics are very, very important. It is very scientific. They sit there and they say, well, you got your scientific disease care and you've got your more mumbo-jumbo alternative health care. Totally wrong. Now, there are people who are into that, but that's not truly structure function care. Structure function care is based on science. As a matter of fact, it is actually more scientific than the disease care. The disease care is something that has been, when you talk about symptoms and putting that together, that's more of a leap of faith.
Who named it, alternative complementary
Well, that was something that they were looking for because we had actually lost the essence of structure function care when we were trying to get things back into balance.
The new paradigm is structure function.
Well, that has always been the name.
The FDA.
When the FDA first came about, when they first were created, they divided everything within a structure function, structure function and disease care.
Yeah.
So this was something that has been around for a long time.
But it's not taught in schools.
In
the university.
No, and most doctors aren't totally unaware of it. It's really at the top echelons of science and also the top echelons of those who handle the healthcare system in America understand the two different models. Matter of fact, the person who actually went over that with me was the FDA. Mm-hmm. An FDA agent went through and explained how healthcare worked, and he explained to me, you are not alternative healthcare, you are not complementary healthcare, you are structure function, and this is our definitions along those lines.
Wow.
And I was like, oh.
Makes sense.
Right.
Yeah.
They have a better understanding than even a lot of the structure function doctors do. Mm-hmm. So,
you'll hear functional medicine, but you got the structure and the function together.
Very interesting point on that. The structure and the function really need to go together to get the maximum benefit. Mm-hmm. Mm-hmm. A very interesting.
I see it all the time.
Yeah, one of the things in this study that they did is they had some functional doctors who said, "Well, we don't need the structural part. Mm-hmm. Let's just do the functional part." Mm-hmm. And their results dropped dramatically. Really, to be effective, you need to have an office that combines structure and function. Mm-hmm. Because if the structure affects function and function affects structure, right. You have to work on both sides of that coin to really be able to get the results. I have had people who have come over from functional doctors and they weren't getting the results. And these were very good functional doctors. Mm-hmm. I'm not quite sure if I was actually better on the functional medicine or not, but we got the results, but we combined the structure and the function. Mm-hmm. And that has a much, and in a scientific, even mathematical types of terms, that makes perfect sense.
Can you kind of put in a nutshell what structure means and what function?
I know, and this is a really new paradigm for people.
I mean, I'm just thinking about our office because I know exactly.
Right, we have them divided between structure and function.
And people are using both of them. Most people coming in because they see the benefits of it.
Yes. A structure is where you are bringing homeostasis to the structure of the body, skeletally, muscularly, even the energetic parts of the body. So you're getting the free flow of energy, fluids, everything is in proper balance. And that's an important part of it. That's where chiropractic comes in. That's where acupuncture, massage, the rehab, the exercises, all those different types of things that play a
physical
role in
medicine.
Mm-hmm. Physical medicine. And then we have the functional part where we're basically dealing with the physiology of the body and bringing the physiology back into homeostasis. Mm-hmm. And the physiology affects the structure, and the structure affects the physiology. And that's just a law. Mm-hmm. That is an immutable law in nature.
Interesting. So what is then disease care?
Disease care is where you are using a pharmaceutical, mm-hmm. and pharmaceuticals are classified as poisons. A properly utilized disease care is when the body is no longer able to establish homeostasis on its own. So you need some type of a poison to shock the body and to shift its course that it's taking. And when the body is no longer able to maintain homeostasis on itself and it's going into a crisis, using a pharmaceutical to basically shock the body back into changing the course that it's at is actually preferred. Mm-hmm. So that is a time that you need to use it. And what we're looking at is a situation where about 80% of all healthcare is structure function, and 20% should be disease care. And that is a healthy, functioning model that not only I agree with the way that it should be worked, but actually the top scientists and the people who are actually thinking about how to improve that have actually said that. Matter of fact, Dr. Guyton himself, who was the basis of our modern physiology, he was like the top guy. Said, they asked him, where are you within? He says, well, I'm not really a disease care model guy. I really don't believe in it. I understand when it should be used, but the basic portion of healthcare should be structure function, because that's the only way that you can bring the body back into homeostasis. So, the top people, the scientists, actually realize that this is really how healthcare should go. Implementing it, though, is going to be a education. One, we have to educate the universities and get that in there. Then we need to get the researchers heading in the right direction. We need the doctors to be heading in the right direction. And then we also have to educate the public.
What about the insurance companies?
Well, also the insurance companies. And one of the things that we're hoping to do is, because the insurance is based on a disease care model, so we need to have a payer system that is implemented, an insurance or something like that, that actually handles the structure function. We don't have the numbers yet to justify that, but as soon as we do, we plan on having a payer system, an insurance system, that actually handles not only the disease care, but also the structure function care. So that's one of the things that, as a leader in the structure function movement, that we need to get in there and help to develop.
So when is disease care best used?
Disease care is best used in a specialist type of situation. If I was trying to learn all the drugs that are involved in working with the heart, that's just a full-time job in and of itself. Oncology, the involvement in that is just overwhelming. So disease care is best used in a crisis type of situation where the body is no longer able to deal with is no longer able to achieve homeostasis on its own, and then really should be done with a specialist. And that is where we really need to go. We have that set up. Now we just need the structure function portion.
Gotcha. Well, up next we'll talk about, you brought up the statistics, that it's increasing, great results. So when we come back, let's talk about what's drawing people to structure function care. Listen to the Voice of Health Radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
I'm a little fat. I went to the doctor. He told me I had to lose 100 pounds. I'm out of shape, folks. I sweat in a cold shower. That's out of shape. 3 weeks ago, I pulled a muscle at the buffet. That's out of shape. Oh, is that ham? Oh, God. I should have stretched. Oh, feel the burn. Feel the burn. Oh, was that pizza? I gotta go. Hold on.
Are you frustrated by not getting to the root cause of your health issue? Are you tired of not knowing why you're always fatigued? Are you wanting to say no to toxic drugs? Have you lost hope? Are you just tired of being sick and tired? At the Prather Practice, we want you to know that we have the answers for you. We offer the alternative to the disease care model. We are the drug-free model to health and wellness. At the Prather Practice, we look for the underlying cause of your health problem and not just the symptomatology. Through thorough diagnostics, we find your individual health blueprint for your treatment. Where the disease care model is symptom-based, the structure-function model we practice gets to the root of your health issue. The Prather Practice is the most comprehensive wellness center in the Midwest. Our integrated practice offers you the most treatment options to restore your health and your hope. Learn more about the Prather Practice by calling 317-848-8048 or learn more on our website at thevoiceofhealthradio.com. I'm Lisa Prather, and you're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where we get to the root cause of your health issue. We're talking today about a new paradigm in healthcare, in the new primary care model. And Dr. Prather, you had talked about, the results of structure function. Mm-hmm. That's the new paradigm, although it's not new. It's been around. We're just trying to bring it out of its...
Yeah, it's a paradigm for America.
Mm-hmm.
It's a new paradigm.
So is the number of people using structure function care growing?
Yes, it is. That is something that is a continually moving type of thing, and the numbers are increasing quite dramatically. We live in Indiana, which is more conservative, but people are definitely, even within Indiana, just moving in that direction and wanting more of that.
Oh, I remember, we've been in practice 25 years.
Yes.
And really, you were the only one doing it back then. Or was a few of you.
Right. Yeah, it was a very small number. If you wanted to get that type of care, that wasn't anything that was actually...
We'd have people come on, that had moved here from California and that. I've been looking for this, didn't know that was here. But now it's a lot more prevalent.
Yes, and a lot of doctors. As a matter of fact, some of the physicians who were practicing around here who kind of poo-pooed this type of thing are now doing it.
You got a lot of flack,
yes.
when you first started.
Yes.
But this is what you're called to do. And
right.
It's to you, this isn't a job. This is what you've been called to do and a passion. And whether it happens in your lifetime or not, that this becomes 80% structure function, and we see the health of Americans in the world.
Sure. Change. That's always been my goal.
Mm-hmm. Mm-hmm. You just walk around and people look ill. It's really sad.
Yes, I have people who come in just to get checked and say, well, I think I'm pretty good, but, I've heard that I need to get evaluated just to see how things are going. And it's very rare that I find someone who I can sit there and say, you're in pretty good shape.
Mm-hmm. Mm-hmm. So who are the people who are using structure function care?
Well, interestingly enough, the people who are going towards structure function are the better educated.
Mm-hmm.
The younger you are, the more educated you are, the more that you have exposure to information. That was one of the things that the information age, because we are able to get outside of the American model paradigm,
mm-hmm.
and we see the effects of the rest of the world, and then we get that influence in, we sit there and say, there are other choices. Mm-hmm. And those are the people who are the most likely to use structure function care. Matter of fact, the more educated you are, the more likely you are to go towards structure function care. It's not the uneducated, it's the educated people who are doing that.
I know, I just heard Sweden the work day is going down to 6 hours, and they found that it's more productive. That. So they're doing 6-hour days now. There's a lot we can learn.
Well, let's not talk to our employees. No, it's easy. That's definitely not my work day.
No, it isn't. So what is drawing people to structure function care?
It's a frustration. It's a knowledge of oftentimes it's bad experiences. And 90% of the people who come into our office who sit there and said, I trusted, the disease care model, mm-hmm. and I've been burned. Mm-hmm. This did not work. And I'm worse off than I was. There could be all sorts of, different things, or they've seen family members that this did not work for. Mm-hmm. And they said, this is not right. I'm going to actually think of some type of alternative to what I'm doing.
Mm-hmm.
And a lot of them are actually even sold. A lot of them are actually in the
Healthcare disease care model.
Disease care model. I have a lot of doctors and nurses and other people say, oh boy, I see it firsthand.
Yeah.
This model is not working.
What would you expect? What would a listener, someone listening in, when visiting a structure function doctor?
Well, the big thing that you need to be prepared for is the only way that we know is if we do a lab test. And I've had people sit there and say, oh my gosh, and people who weren't really prepared to do structure function, are like, that's just over testing. But you don't really know unless you test. And there's some basic types of things that are important. And these aren't huge multi-thousands dollars worth of tests.
No.
They're not really that much, so we don't have to go crazy. The disease care model actually goes a little, there are times to do those, but I think that a lot of the testing is overdone. But, there's some basic types of lab tests, and understanding the physiology of the body, understanding the structural changes that are taking place, understanding the tissues of the body, what's going on with that, the gut. Those are all basic types of things that if you don't know, you really can't get the results. If you don't know, you can't treat, especially actually you can necessarily not know in disease care. You can just treat by their symptoms.
And not know the root.
And not really understand the root.
Interesting. So how does a disease care doctor and a structure function care doctor differ on their approach, to a problem?
Certainly.
You've kind of addressed it.
Right. Once they, it's the, I've actually gone to medical school classes, and one of the common types of things that a medical student will actually raise up his hand and say, yeah, but what was the cause of that? And the professor rolls his eyes and says, we're not interested in the cause. You just treat the disease. What do I have to do to get through to you? And they go, oh, okay. And they say that enough, and you're young and impressionable, and you actually believe that. The first thing that a structure function doctor says, okay, what's the cause of this? What's the underlying root that we can get rid of? So huge difference on that. And one of the things is that we have a medical director here, and we have him here to be able to communicate between us and the specialists out there, because we talk different languages, and I've had to learn how to talk disease because I'm structure function, and he's had to learn structure function talk. And the nurse practitioners we've had in here, and they say, wow, this is a whole new paradigm. I'm just not used to this. So there's a communication gap. And that's one of the things is I really believe that we have to integrate the two. And that's one of the things that we're really working hard to achieve.
Okay. Well, let's talk. Here at the Prather Practice, we do structure function medicine. We've been doing it for 25 years. 30? Okay.
You've been involved in 25. I've been involved 30. So you are speaking, you're correct. You've been involved in 25, but I've been doing 30. I know.
So what conditions are treated here at the Prather Practice?
It's really anything, because we don't treat conditions. We treat the person. Okay. So we, and that's actually, a question that I put down. And it was kind of a trick question.
You're giving me trick questions.
I'll pay for that later. But it's we don't treat the symptoms, we treat the cause. And so we're trying to improve anybody and everybody.
Right.
And we can do that by treating and getting someone back into homeostasis. So it doesn't matter what you have. So
let's talk about a simple cold. Can you treat that here at the Prather Practice?
Absolutely. And what we're doing is, why did you get the cold? And there can be a lot of different types of reasons. You could be low on vitamin C in your body, which makes you more susceptible. We're not treating, the condition. What we're doing is treating the underlying reason on why that was able to come in. So as we improve the body and how it's functioning, then all of a sudden it's all working better, and you get rid of the cold. So we have excellent results with colds. So we can actually treat someone with a cold and get some very quick results.
Why is there such an emphasis on diagnosis?
Diagnosis is just so important. The labs just are critical to understand, what's going on. And I've been accused of being a vampire because I love to draw so much blood, and we do it more often than actually doctors do, because I want to see what kind of changes are going on. So trying to find out what's going on.
Blueprint to
Blueprint
health.
to
We've done a whole
health.
show on that. Yeah. Now, do you believe? I want to just make sure we don't run out of time because there's some good questions.
Sure.
Do you believe that structure function care can save the health crisis in America?
Absolutely. It is the answer, and it has actually been proven. We do have the studies where they have done it in large populations. And we could reduce, we could reduce the cost of healthcare across the board by 60%. Just by implementing structure function care into our present model. And that would save the federal government, that would save businesses, that would just be absolutely huge. And with 85% improvement in the results. So not only would it cut down on costs, but it would also result in a healthier population.
We have about 10 seconds.
Okay.
How would you like to wrap this up, Dr. Prather?
Everyone should be thinking about structure function. Open up your minds to the new paradigm and seek out a structure function doctor and get started.
Okay, great. Well, I want to make sure, although listeners know, that up next we have a patient, Anne, sharing her family's experience with the new structure primary care model, structure function model here at the Prather practice. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. Dr. Prather, there is a device you use at your office called the electrodermal screening, or EDS. Tell us a little bit about it and why you call it the lie detector for the body.
Well, the electrodermal screening unit is a galvanic skin response unit, and it actually falls under the same category as a lie detector test or biofeedback. So it is actually, we can actually rig our electrodermal screening to actually do lie detector. But it is also a good term on that is a lie detector for the body. When you're actually, you know a whole list of different types of products that could possibly work in each type of situation, but everybody knows that not everybody responds well to penicillin. Some people actually have some very negative reactions to it, matter even to death. Some people, it's a lifesaver. Well, that's true of everything. And what the electrodermal screening does is it actually gives you a predetermination on how you're actually going to respond to any type of thing that we might prescribe to you before you actually take it, which is extremely helpful. Now, it's not a diagnostic tool. It is not classified as a diagnostic tool. But as we've gotten the approval from the federal government on the use of it, we use it purely as a means of checking to see the body's response before you would actually take something.
Okay.
So it's a response machine. Now, you have to have knowledge beforehand on what products will actually work with each type of condition.
Right.
So we're very dependent upon our lab tests and the gold standard types of diagnostic tests. But then once you've determined that, what do you do with that? Because in our instrument, we have actually 80,000 different products that we can check on.
Wow.
So with that, we can actually find out what's going to work the best for you and how you're going to respond on things before you actually take them.
And what about its effectiveness?
Through clinical studies, they have found that it's 80% accurate, over 80% accurate, which, was what actually attracted me to it, because there's not too many things that you can actually have that kind of results with.
Right. And this electrodermal screening eliminates some of the guessing.
The guesswork is the biggest thing that we're trying to get rid of.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients. Okay, I have Ann here who is going to share her story of her experience here at the Prather Practice. And, well, first, welcome, Ann.
Thank you.
And tell us a little bit about what brought you into the Prather Practice and how long have you been coming to the Prather Practice?
I think we've been coming for probably about 2 years now. We started off bringing our then 8-year-old who has a seizure disorder and had been on seizure medication since she was 1, and also suffers from behavioral issues, ADHD, some anxiety, depression. All of those had been diagnosed before we even walked in the door. And we were experiencing a lot of issues at school, specifically when the work ramped up, her anxiety ramped up with it. And I had a good friend who I had contacted who probably for a year before that had told me about Dr. Prather. And I eventually said, I think I'm ready to go see that doctor.
What got you to that point?
I think a lot of times as a parent, especially a parent with a special needs child, you have to kind of get to that breaking point of, you know what, the traditional medicine isn't working for us. In fact, maybe it's hindering a little bit of our success. And I think we had finally, as a family, got to that point where we just needed something different. We needed somebody to look at the whole child and not just treat the symptom, but treat the whole child and figure out why this was happening.
So I know your whole family comes in now,
yes,
right?
We do.
But what was your experience with her when you brought her in?
With her, the first thing that Dr. Prather did was he did a complete blood workup on her, a hair sample, and just tried to figure out what her body was saying. And what was so interesting was when we did the EDS, everything that we knew was happening in her little body came out in the EDS. And that was really overwhelming at first to find that information confirmed that we knew. And then the treatment it wasn't an immediate treatment. It was a very slow treatment because what we found was as you treat one symptom, maybe something else might show up. And so we started our goal was to get her off the seizure pharmaceuticals so we could see the real Katie behind the pharmaceuticals. And so that was our goal when we came in. And that took it took till this August. I mean, it took about 1.5 years to get her completely off her seizure medication so we could see what she was like without those pharmaceuticals in her body. And what we found was we weren't just coming to Dr. Prather for our sessions to find out how her blood work was. We were coming when she was sick. We were coming when our family members were sick. Opened my husband's eyes up. He's had medical issues for quite a while, digestive issues. He started coming. Our daughter is a runner, our oldest daughter, and she was having some issues with her back and her legs, and so she started coming. She had low iron, which was a whole nother issue. It was holding her back from running. And then I think my son came next, and he actually has some issues with his back, so we seek chiropractic treatment for that. And then finally Mama came after I
Mama's last.
Yeah, I was always last, but I love it. Dr. Prather is the first person I call when something comes up because I know that I will get personalized treatment from him and his family, and I feel like we feel like we're part of the family.
Aw, thank you. Well, tell me a little bit about how your daughter has changed and benefited.
So Katie's main issues were behavioral that we had seen, and we suspected a lot of it was side effects from the seizure medication. What we discovered about a year in, Dr. Prather had mentioned some brain core therapy, and we decided that might be a good adjustment for Katie, so that she could have some treatment along with trying to wean her off these pharmaceuticals that her body was used to for almost a decade. So the brain core therapy along with Dr. Prather's treatment just really complemented each other beautifully, and I think that's what finally helped us completely eliminate the pharmaceuticals.
And we do the brain core therapy here through Leanne O'Neill.
Yes.
Yeah, it is a nice combination.
It's fabulous.
Yeah.
It's very good. And what happened with the brain core therapy is it complemented along with Katie's supplements even the behavioral issues. And so now that we're off the seizure medications, we just do a maintenance and go back to brain core like once a month, just for maintenance for her. And I think it's also, she is that's something that's part of her life. She knows when the worrying and the anxiety ramps up, I need to go see Leanne because I need therapy.
And how is school going for her this year?
Great. This year, this is the first year we've seen her take off academically.
Oh.
So I think once you get all those social issues behind you, then they finally can learn like they need to learn.
Yeah.
And academically, she is doing fabulous.
Well, she's a cutie patootie. We love when she comes in. And, she's a sweetheart. Well, let's talk about your issues. What brought you in?
So for me, I think as a mom, you tend to push all your issues behind and say nothing's wrong. And
take care of everybody else.
Right. And I had spent probably the last 5 years in a complete anxiety-ridden state over my child who was suffering.
Yeah.
And so a lot of times when that happens, things happen to your body that you don't even realize you're doing, from stress and worry and just that constant taking care of someone. And so for me, it was, let's just see what I look like. What have I been doing to my body? And it was exactly what I suspected. The stress was, I had issues going on in my back because of stress. I couldn't run anymore. And most of that was stress related. So with the rehab therapy, some chiropractic therapy, and then supplements, I also have a low thyroid, and so my sleep was off. And so all that was discovered, and you don't realize it because you kind of put it on the back burner, and you think you can deal with that. But then all of a sudden, when you start to feel good, it's like this whole new world opens up. I finally had energy again to deal with the issues that happen with 2 teenagers in a household and a 10-year-old who suffers from behavioral issues. And I had that energy to put into it, which, ultimately led me going back to school and continuing my teaching degree. So
that's great.
Yeah.
That's great. What a story. Well, if someone's out there listening and can connect with part of your story and your family story, what would you say to them?
I think the first thing I would say is don't let yourself get to the point where you're breaking, where your family is breaking down and your family is hurting, even if it's just from one member in your family. Seek treatment and seek help. And it really is out there, and it's in non-traditional medicine. And a lot of times I felt like I was always looking for the pill to fix it. And a pill doesn't fix it. It treats the symptom, but it really never tells us the why behind. And there's so many chemicals going on in our brain, and just the fascination of our neural pathways and what we do to that just from circumstances that we go through. We need to be aware of our entire body and our whole body and stop treating just the symptom because it's not beneficial to us as a whole person.
Yeah.
So I would say don't get to that point where you feel like okay, I'm ready to try that last resort. It shouldn't be your last resort. It should be your first resort to take care of yourself, your family, and your body.
Well, thank you, Anne. It's going to be very encouraging to a lot of people. Thank you for your story.
Thank you.
The Prather practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather. Healthy Habits from the Prather Practice is a natural weight loss program with a proven success rate. Healthy Habits is an individualized program that is tailored to each patient's needs. Healthy Habits is not a trendy diet. The program actually resets your body's metabolism for optimal fat burning. The Healthy Habits program includes concentrated vitamins and minerals that help you to burn fat and feel more energetic. Healthy Habits provides support from a counselor and exercise physiologist in order to maximize your results and help you create new healthy habits in your life. This program even helped our own Dr. Prather to lose 24 pounds and shed 4 inches from his waist in just 12 days. Schedule your consultation with a Healthy Habits counselor at the Prather Practice at 317-848-8048. That's 317-848-8048 or on the web at thevoiceofhealthradio.com. The Prather Practice, restoring hope.